Hello my lovelies, and welcome to today's video. My name is Alya and I'm so glad you stopped by. So today we're talking about eye injury and trauma. So I'm going to let you know what I would do in different situations, different signs and symptoms I look for, and what they might mean for the eye and the brain. So stick around if you're interested. Well, darling, today's topic is interesting for so many reasons, and the main one for me today is that I myself, if I can just show you, don't know if it's going to be visible on camera, but that right there is a very scratched up conjunctiva. So today I was being what I always am, the jack of all trades, and I was doing some pruning for a tree, and one of the little spores, the little seedlings that came down off the tree went right into my eye, and actually that happened twice. And should I have been wearing protective eyewear? 100%. I am the biggest hypocrite for not wearing any eyewear, but it was a last minute decision. I just saw that silly branch hanging there while I was putting the lawnmower away after doing some mowing. I thought, oh, I'll just quickly pull it down. And one branch I just literally pulled down with my weight, and the second one needed a little bit of encouragement from a handsaw. Anyway, it was so silly. It was just me trying to just quickly get things done and not really thinking it through, and hence today's topic. So it's actually a good one because eye injuries are so incredibly common. We see them incredibly often, more than I actually sort of commit to memory, because they're just so incredibly regular in the clinic. And they range from a little scratch, a little bit of dry eye that was left unattended, maybe a little bit of chemical exposure because of makeup or eye products or creams that weren't really intended for the eye but went in the eye. Shampoos, we never really fully find out what started the process for most people. By the time they come to us, their eye is sore, it's red, it flares up, it gets better, then it flares up again. And it's really hard to know where it all started, because you really do have to rely on the history that you can get from a patient, and the patient really can pinpoint themselves where it all began. Often they didn't even realize what happened. They woke up the next day and their eye was red and sore, and then it never really recovered, and then it recurred. And so the cycle began. Sometimes they've already tried various eye drops at home before they came to us, which is always great to hear, because at least I know that they're trying to heal the eye, and we've already sort of eliminated a few options in the process, which is really great. So first of all, different types of eye injuries that can occur. The most dangerous are actually blunt traumas, in my opinion. This is just my humble clinical opinion. I feel like blunt traumas can be extremely dangerous because they can cause like a ripple effect in the eye, which can lead to brain injury, which can lead to orbital fracture, so the fracture of the bones just down here, or sometimes even up here, more rarely, usually the cheek cops it the most, and sometimes can even cause bleeding behind the eye or in the brain. Now, this is why one of the first things we check when someone's had an injury to their face or to their head is the reaction of the pupil. So literally take a pen torch and shine it on one eye and swing and shine it onto the other and swing back again, and watch what happens to the pupil. So what should happen is both pupils should equally and simultaneously constrict when either of the eyes have had a light presented to them. So even if I'm shining the light on the right eye, the left eye should still constrict, and vice versa. It shouldn't be painful. It should just, it's uncomfortable obviously to have a bright light being shone in your eye, but that's about as horrible as it should get. It should definitely not be painful. The next thing that I look for is eye movements. I just make sure that all the extremes can be done. So we always go up and down, we always go left and right, and when you're left, it's always good to go up and down, and when you're right, it's always good to go up and down as well. Sort of like a Union Jack almost, yeah, or kind of a letter H type thing. That's just going to make sure that none of the muscles around the eye are trapped in any bones. You don't need to really be worried about that sort of thing if there's a bruising on the face or swelling on the face. If something just got into the eye, you're more worried about the actual eyeball being scratched up, or maybe even a penetrating injury, and that's probably my second most serious one I'd be worried about. So a penetrating injury is when something actually ruptures the eyeball or disrupts the enclosed structure of the eyeball. In this case, the most scary consequence would be infection. That is, if the eye is going to survive all of this. So it can be patched up and, you know, repaired and closed up without any too serious consequence. Because once something can get inside the eye, there's no real protection in there for infections and things like that. All those protections exist on the outside. I always look for, if a patient shows up with a scratch or an abrasion or anything like that, that there's no liquids coming out of the eye. We could be talking blood, we could be talking just tears, we could be talking mucus, we could be talking gelatinous type material as well. And that can be a sign that the internal stuff of the eye is seeping out. And that means that there's been a pretty severe scratch, or an actual penetrating injury. So normally that would be, you know, some kind of a bar fight or some sort of a sporting injury. It would have to be quite a blow for something to get through the very, very intense structure, which is our sclera, or the white part of our eye. A lot of the time what you're going to have is like what I have. It's just a really, really irritated eye because it's been scratched up by something that didn't belong there. Perhaps there's also a chemical component as well. And that's another really, really common one, so debris. So we've already spoken to the signs of the pupil, what we expect to happen there, what kind of signs we expect to see there. If the pupil is reacting differently to its counterpart, we could be really worried about something happening inside the brain. For that sort of thing, you'd want brain imaging, something like a CT scan or an MRI, to make sure there's no injury to the third nerve inside the brain. If it's just one not reacting and the other one reacting, it could be a blowout. So it could be that the actual iris was damaged, or it could also be that there's something happening at the back of the eye and the eye is just not seeing the light anymore. So you always want to check vision. So, you know, can you see my fingers? Can you see the light? That sort of question to the patient or to the person who sustained the injury. Assuming they can see and assuming it's not too badly blurry, the other thing that can be causing a difference is if there's blood pooling inside the front of the eye. So you also want to check for something called a hypopion, but basically there's going to be a red line of like a little pool of blood right here at the bottom, because this front section is actually a little chamber called the anterior chamber, and things can gather in there. There's about, you know, up to about 3 or so millimeters between the iris and the front of the back end of the cornea. There's lots of room for stuff to gather in there, given the opportunity. So you definitely want to be checking for that. While you're there, you may as well check if the actual pupil is the right shape. So if it's a little bit of the wrong shape or a little bit more like a teardrop rather than an actual round circle, it could actually be a sign that it's torn, or the iris muscle is torn, creating this little teardrop shape. If that's the case, that is definitely an emergency. All of these things really, you'd want to be seen by a professional ASAP. But these are all things that are quite urgent. Like 000 in Australia, 911 in America, you would call an ambulance for this sort of thing. Sometimes people will be complaining of distortion just because their cornea is scratched or their eye is really teary from the injury. So you really want to see that everything is in place, and as long as the eye is whole, there's no actual blood or anything gushing out of the eye, or seeping, I should say, wouldn't be gushing, seeping out of the eye. If you can, get yourself some saline. If you don't have saline, just boiled water and salt will create saline. If there's no time for that, for the boiled water to cool down, you can use bottled water. But the idea, just sort of to mix it up and cool it down, but the idea is to sterilize the water as best you can. So boiling it, adding some salt, mixing it up really, really well in a very clean bowl or something like that, and just flushing it. And the best way to flush someone's eye is to tilt the head right back, look out to the side like this, so you can sort of expose as much eyeball as you can, and just pour, pour, pour as much as you can, as much as you or your patient, whoever's sustained the injury, can tolerate. It's really important to get as much out of the eye as you can. You do not want to rub the eye. That's very important. Avoid rubbing the eye, because if there is a little bit of wood or metal or any kind of dust, even debris in that eye, rubbing it could actually cause it to, to scratch up the surface even more. The most common type of injuries will happen in the home. I mean, unless you're a tradie of some sort and you're working in a dangerous work site, like you're in construction or something like that, there's not really too much risk that your eyes are in. And even then, most places will make you wear safety goggles or something like that. So hopefully nothing too bad is going to happen to you. welding is another really common one. We see people with bits of metal ground into their eye, whatever, because even though you might be wearing goggles, sometimes they slip, or sometimes the metal just flies in such a funny direction that it still makes it into the eye. So that definitely does still happen. Anyway, having said all that, as long as there's nothing sort of obviously sitting there in the eye, it's still a really good idea to flush. But even after flushing a lot, you still want to be seen by at least an optometrist or an ophthalmologist so that they can see if there's still something in that eye. Because if there is, it really needs to come out. And the way they normally do it is by taking a little needle, anesthetizing the eye so you don't feel a thing, and making sure that the eye has the best chance of healing. Because it's not going to heal whilst there's something sitting there rusting away or tearing away at the surface gradually over time. You really need to get rid of whatever foreign body is in. And friends, you definitely don't want to do it at home. This is something that has to be done as sterilely as possible, as neatly as possible, with minimal further damage done to the eye as possible, but also a lot of antibiotics or maybe anti-inflammatories or something else needs to be applied to help the eye along the way. I personally wouldn't put anti-inflammatories in. I think that inflammation is important in the healing process, but definitely antibiotics, because it just goes without saying, when something gets into the eye, it's unlikely to be something clean. The other thing that happens at home a lot is chemicals get in the eye, whether it's shampoo, even essential oils. They don't all belong in our eyes, that's for sure. Chemicals for cleaning, soaps, different sprays. Hair dye is another common one that we see a lot in the clinic. Nail polish remover. That's been an interesting one I've seen a couple of times. In all these instances, the first thing I would personally do is flush it out. Flush it out. If you're alone and it's happened to you and the only thing you have at your disposal is just a bottle of water, just one of those ones you get a big pack off at the supermarket, that's good enough. I probably wouldn't use tap water, but again, if that's the only thing you have at your disposal, it would be well worth it. As long as you're in a country where tap water doesn't have anything gross in it. So in Australia, the most horrible thing you could put in your eye from tap water would be chlorine, which at the end of the day, yes, it's an irritant, but it can't be any worse than whatever's in your eye already, which is, it's a known risk in that scenario, but it's definitely safer than leaving whatever is burning your eye or irritating your eye in there. So yeah, definitely try to use cooled boiled, salty water, and if you don't have that, then just bottled water, because at least it's been filtered and cleaned. And then failing that, you can definitely use just tap water, as long as where you are, the tap water doesn't have any kind of gunk swimming around in there. In some countries, you're not even allowed to drink the tap water or wash your face with tap water. Like, you're not supposed to rinse after brushing your teeth with the tap water. Obviously, in those places, you wouldn't rinse your eye out, even in a pinch. You would try and get your hands on some filtered or bottled water. The other really common thing that happens, which is a type of trauma to the eye, but it's so common, and you could sneeze or cough and that would be enough, or just wake up like that. And that is a subconjunctival hemorrhage. That is where you see this really big bloody red eye and nothing's really happened that you can recall. Nothing scratched you, it doesn't hurt, you're completely unaware of it until you look into the mirror or someone says, hey, what's wrong with your eye? Now, subconjunctival hemorrhages are so common. All it is that there's lots of little invisible, really, vessels running inside your eye underneath the conjunctiva. So that's why it's a subconj hemorrhage, a subconjunctival hemorrhage. And one of those vessels, when we are under some sort of strain, like coughing or sneezing, can just sometimes pop. And when they pop, they leak, and all that blood's got to go somewhere. And remember, I mentioned earlier how it's an enclosed globe, so it's not going to go inside the eyeball. It's got to pull somewhere until the other veins can suck it all up and get it back into the circulatory system. So it looks really unsightly and painful, but really it's just not a big deal. If they're happening all the time and you're not taking any medication that could influence it, like say aspirin, then I would definitely have it checked out. There might be something wrong with your vessels there, and that'd be worth looking into, or there could be something that's regularly causing these vessels to burst. But if you're not taking blood thinners or any other medication that can cause such things to happen, like bruising around the body, then I would really be checking it out. It's not normal to have it all the time. Occasionally, sure, but not all the time. Now, if we go back to getting an injury to the eye, so again, if you get a whack to the face and you've got a black eye, but it's okay to move your eye around, nothing's torn visibly, the eye itself isn't too red or anything like that, would I then bother to go see a doctor? Because it's not really my eye that's the problem. It's just, black eye, big deal. They happen all the time, especially if you're in sport or, a bit clumsy, and sometimes black eyes happen. Now, the truth is I would have a dilated exam. I would have drops put in my eye to make my pupil larger, to make sure that the back of my eye is intact. So remember how I mentioned there was that ripple effect? So any kind of injury to the head or face always runs the risk of retinal tear or retinal detachment. And that always scares me. And sometimes you won't see it on pupil reaction. You won't see it on vision changes. It's something that's happening out in the periphery where on a sensory level, we're not able to detect it until somebody goes and physically looks for it. It won't be found. But then over time, it just keeps tearing and tearing, detaching until it becomes a big detachment or a big tear. And those need to be repaired surgically. Whereas if you catch it early enough, sometimes you can just use a bit of laser to sew it into place or burn it into place, and then it's of no real consequence to you, well, not until you get the next injury, which if you're unlucky enough to do so, well, it's a shame. Really, those lasers last really, really long if you're lucky. Occasionally they don't, but usually they do. So if you're like me and you've gone and got a bit of a branch stuck in your eye, all you really need to do is wash it out. As long as there's no signs of infection and the pain goes away quickly, something like this you can get an over-the-counter antibiotic for, and that is more than sufficient. Me personally, I'm probably just going to keep using some lubricating drops and see how I go there, but that's because I'm in a bit of luxury where I go to the clinic every day, and if I really need, I'll just pull something off the shelf and use it. So if I was a private citizen, or if my clinic was closed for the holidays, for example, I probably would have gone to the chemist today and got some eye drops just to have them should things get worse. Should I wake up tomorrow morning with some pus in my eye, I'll know that I need to get onto that antibiotic straight away. If it's redder tomorrow or sorer tomorrow, or it's a little bit different in size to my other eye, or any other way changed tomorrow, having had that little bit of debris in there, even though I flushed, even though I've used lubricating drops, even though I've made every effort that I know how to make to improve the situation, antibiotic drops may just have to be utilized. Sometimes home remedies are good enough. Sometimes you want just to use a little bit of, tea or lavender oil diluted, things like that. But usually in situations like this, you want something that's quick and definitely going to work. So I hope today's video was informative and it gave you a little bit of hints of what to do if you're ever stuck in that kind of a situation. And I'm really sorry if that ever does happen to you. But for more videos like this, please do hit subscribe. Make sure you like this video if you like this type of information, so I know to bring you more topics like this one. If you haven't done so already, jump onto Instagram and see what else is going on in the big world of Alya's creations and all the things that I'm involved in. Leave me a comment if you'd like to tell me anything about this video, ask me any questions. Wherever you are around the world, I hope you're staying happy and healthy and safe, and I can't wait to see you on the next one.